Are you aware there is something called pregnancy related conditions? These conditions you don't have them before you get pregnant, but in pregnancy you might have it. Mind you, it's not everyone that have these conditions in pregnancy. Some people carry their pregnancy to term without having any of these conditions. But let me tell you something, 80% of women have these conditions in pregnancy. It is pregnancy related. That is, after the delivery of your baby, it is meant to stop after 6 weeks, which is the puerperium period after delivery. I want you to like my video. I want you to repost, share, and also drop your questions in the comment section. So, number one of this condition is anemia. Let me tell you, in pregnancy, you are supplying your baby blood. That is the reason why during pregnancy you are meant to do your full blood count, check your PCV, to ensure that you are not anemic, because in pregnancy your volume tends to increase because you are supplying your baby blood. So anemia is a pregnancy related condition. This is the reason why you are always being monitored for the level of your packed cell volume. That is the level of your red blood cells in your body. In pregnancy, you are supplying your baby blood too. It is not just your blood this time around that has been working for your body. Your baby also need to get some of those blood to survive through the placenta. So this is the reason why there is 100% tendency to be anemic in pregnancy. Don't worry. Don't be like, oh, I've never had anemia in my life. Why is it that in this pregnancy, the doctor is telling me that my PCV is low, my this is low? Don't be afraid. Just ensure that you are taking proper diet, and you see that your drugs, those routine drugs they do give you, there's iron inside. Those iron will help you. Those iron inside the routine drug that's been given to you will help you to produce more red blood cells, so that there will be enough blood for you and your baby. So this is one of the reasons why you don't want to play with your routine drugs in pregnancy. Yes. Another one is what we call hyperemesis gravidarum. That is just a big English actually. It means vomiting in pregnancy. Some people keep vomiting in pregnancy. Why? Because of a particular hormone. This hormone is known as human chorionic gonadotropin. We call it HCG. Which is one of the important tests to confirm pregnancy. You see, HCG is a chemical also known as hormone that is released in pregnancy, that's also meant to to keep your baby, to allow the placenta to grow, to allow the formation of your baby and the placenta and all that. But some people are sensitive to this hormone, so they tend to be triggered by this hormone, and they vomit constantly. But when the vomiting becomes so consistent, problem is a pregnancy related condition. When you keep vomiting every day, after eating in the morning you vomit, after eating in the afternoon you vomit, even in the night you are vomiting, then you are meant to be dehydrated. Yes, there's a high risk of lack of diet, which is not good for you. Dehydration, and you are not meant to be dehydrated in pregnancy, is a big risk. So when you're in pregnancy and you are having a consistent vomiting, please go to the hospital. Let them take care of you, let them manage you well, because you need to eat for the sake of your health and your baby health. The third one is known as pregnancy induced hypertension, which we also call gestational hypertension. You might not have hypertension before pregnancy, but in pregnancy you are now having hypertension. Please calm down. It is pregnancy related. After delivery and some like 6 weeks or some months, it will definitely stop. Yes, if it is pregnancy related, it will definitely stop. You see, this hypertension usually occur at 5 months of pregnancy, which is known as 20 weeks. After 20 weeks, you start having hypertension. And the risk factor for it is like maybe you have a kidney problem before, or you are 35 years or older before you get pregnant, or maybe because you have hypertension before you even get pregnant. So these are risk factor for you to have hypertension in pregnancy. And besides, your baby is growing, your body is adjusting to so many things, your heartbeat, your blood volume, the whole thing is now different entirely and needs to adjust to your baby growing inside you. So having hypertension is a pregnancy related. Your whole system is adjusting to your baby inside of you. So having gestational hypertension is not a problem. Definitely you will be managed. Yes, for all these conditions you need to be managed. I've talked about anemia. If you have anemia in pregnancy, then please don't play with your diet. If you are always eating and vomiting, you need to visit the hospital. Let them manage you, because you cannot continue to vomit, then definitely your baby is not eating, and you too, you are not eating and you are carrying a baby. It's going to be difficult. In fact, having low PCV less than 30 in pregnancy is not allowed. Your normal PCV, I think, is from like 38 to 42 in women, but in pregnancy if you have up to 30, it's still allowed because of your baby. Like your baby is also taking some blood supply from you, right? So having good diet in pregnancy will help to reduce the risk of anemia. And if you are vomiting, which is the second one, hyperemesis gravidarum, please don't take it lightly. You know that you are always vomiting. Every time you're always vomiting, go to the hospital, get the doctor attention, go for consultation, let them treat you. There are some drugs to manage it. And even if it's also gestational hypertension, there are also some antihypertensive to manage it. Don't self-medicate. There are some BP drugs that you are not meant to take in pregnancy, and we also have some BP drugs that can be taken in pregnancy, but that need to be prescribed to you by your doctor. All right, guys, it's your girl midwife Fola. I want you to like, share, repost, because this information might help one or two person there. Thank you.